Greetings to all. This is Dr. Nick Ravan. I hope you guys are having a lovely day. I want to discuss a topic that's extremely important. There's so much wrong information online and wrong information being given by providers to patients, messing up their diabetic profile. And that is GLP-1 drugs and surgery, how long you should hold it prior to surgery. I'm hearing 4 weeks, and that's crazy. That's wrong. And let me tell you why. But before I make my case to see how long you should hold the drug, let's talk about normal physiology. Exactly. Because if you understand what normal physiology is, then you can make pathology very easy understandable. So if you consume a liquid and you're non-diabetic and you don't take these medicines, liquids stay in the stomach about 30 minutes, maximum 60 minutes. If it's food, it's between 2 to 4 hours and maybe 4 to 6 hours for complete emptying of your stomach. Exactly. Now, if you go on a GLP-1 drug like Wegovy, Mounjaro, Ozempic, or semaglutide orally like Rybelsus, now the liquid, instead of 30 minutes, can go to 90 minutes. Solid foods can go between 4 to 6 hours, and complete emptying can go from 6 to 12 hours. You heard me correct. That's why the hype is about, oh my God, how long we should hold it. Maybe we could hold it for a couple of weeks, for a little month. And the answer is no. If you really want to maximize the metabolic profile, diabetes care benefits, all you need to do is hold it for 1 week. And let me tell you more. In JAMA, it was in April of 2024, they looked at a study cohort specifically to see exactly, was there a difference between those who held the drug at day before the procedure, at the procedure, and they found out there was no difference, 3.5 versus 4% in the large study. And that's not statistically significant to make a difference. In the World Journal of Surgery in January of 2025, they looked at the specific topic and they found no significant difference for those who held it or did not hold it. Also, there was 714,000 patients across 34 case studies, and they found no statistically significant difference. That's why the American Society of Anesthesiology has come up with a consensus statement saying that, you know what, even though we don't think it's a big risk, but aspiration pneumonia is a problem, because if the food stays in the stomach too long and you go to general surgery and you did not obey the fasting rules accordingly based on the medicine, you may aspirate, and the aspiration can be catastrophic for the patient. Therefore, if you're taking the oral version of this medicine, you should probably hold it the day before. So just 1 day before. If you're an injectable medicine, which lasts a week, then you should hold it for 1 week. But holding it more than 1 week will mess up the diabetic profile, the patient's blood pressure, cholesterol, diabetes profile. The insulin resistance will get really messed up. So therefore, that's wrong advice. So number one, if you're on this medicine, you want to probably hold it for about a week. And one of the reasons I'm more proponent for holding it for 1 week, based on all the literature that I'm looking at, is because when you go on these medicines, the gastrointestinal GI symptoms can be bigger. They can be more pronounced. So when you go to surgery, they give these anesthetics, these narcotics, and narcotics are notorious for what? Nausea. And guess what? They gave you Zofran to mitigate, to improve the nausea. But guess what Zofran does? It affects the serotonin receptors in the intestine, which then causes major constipation afterwards. Then you've got this drug, surgery, Zofran, and patients typically get constipated after surgery. So my recommendation from 20 years of experience prescribing these drugs as an endocrinologist is that you want to hold it no more than 1 week. Hold it for 1 week, but make sure you fast for 12 hours prior to your procedure. Not 8 hours, not 10 hours, 12 hours. And the night before, make sure you don't eat a big meal. Make sure you don't eat a fatty meal or a meal high in protein, because that takes longer to digest. So lessen the meal intake. For example, if your procedure has 8 in the morning on Monday morning, 6 p.m. at night, make sure that's your last meal, or 8 p.m. is your last meal. Make sure it's a very light meal. That means your last bite should be at 8 p.m. Not you start eating at 8 p.m. Therefore, you want to fast at that moment, and you should be fine. And I can tell you, with 20 years of experience of prescribing these drugs, I have never had a complication of aspiration pneumonia, because we obey the physiology of how food empties in the stomach and make the advice to the patient. I hope this information is very useful. Please, please, please share it with your friends, family. I'm more than happy to make arguments and discussion regarding this, because it's a very important topic and you don't want to get aspiration pneumonia, although likelihood is extremely low. But therefore, follow the instructions, the guidelines, and you should be fine. Thank you.